Okay. So, good morning, everybody. Today, we're going to continue with cardiovascular risk in terms of smoking and alcohol. So it's cardiovascular risk reduction, smoking and alcohol. So just quickly, hopefully, some of you have been around for the other chats in cardiovascular disease, whether it was coronary heart disease, stroke, blood pressure, etc. So we're going to have a quick review of non-modifiable and modifiable risk factors. So let's get the non-modifiable out of the way. So in terms of cardiovascular risk, and by that I mean anything that can predispose you to having a heart attack, a stroke or peripheral vascular disease, what are the non-modifiable risk factors? There are 4 of them.
Genes.
Pardon? Did you
Genes.
say genes, your genetics? Yep, genetics. Yep, you can have a family history of cardiovascular disease, or you can have a genetic predisposition to having familial hypercholesterolemia, high cholesterol. Yep.
I'm going to say ethnic origin, but...
Sorry, say that again?
I'm going to say ethnic origin, but
yes, ethnicity. Yep, no, ethnicity is important as well. Yep. Good. So ethnicity, genetics, I've got 2 more. The 2 more obvious ones, I would suggest. Age is one of them. Age is one of them. Sex is the other. Yeah. So whether you're male or female, and by that I mean XX or XY. There's a lot of coverage of that at the moment, obviously, in the news. I like to keep it quite simple. Age, so yes, you're more likely to have a heart attack or a stroke at the age of 80 than you are at 20. Okay. Not a done deal. People do have issues in their 20s, but it's obviously a lot less common. Okay, so those are the non-modifiable: age, genetics, ethnicity, and sex. All right. 4 legs have just appeared. Right, so on to the modifiable ones. Let's chat to the modifiable ones. And I'll give you a wee heads up. So smoking and alcohol are 2 of the non-modifiable ones, because that's what we're going to, or the modifiable ones, because that's what we're going to chat about today. So let's rattle through the other modifiable ones.
Weight.
Weight, yep, weight's very important. And especially when you carry weight around your abdomen. Truncal weight, because that increases your risk of insulin resistance and cardiovascular disease. Yep, weight.
Diet.
Diet. Yep, so nutrition or your diet is very important as well in terms of cardiovascular risk.
Lack of exercise.
Yeah, so exercise or being sedentary. And those are 2 slightly different things. So being sedentary, you can exercise, you can go to the gym 4 or 5 times a week and work out for an hour, but if you predominantly sit the rest of the time, you're sedentary. So exercise and not being sedentary are very important, or increasing your just daily movement, I would suggest. Excellent, good. Blood pressure is another one. Okay, that's a modifiable risk. You can modify that with weight loss. You can also modify that with medication. And then cholesterol is another modifiable risk. That's obviously been linked to heart disease. And it's funny because when I do the lipid or diabetic clinics, everybody gets very hung up on their cholesterol and their triglycerides and wanting medication to reduce these. Or get twitched about the numbers of, you know, what level their cholesterol is. And I think it's incredibly important to look at the other 5 or 6 modifiable risk factors. You know, we can get your cholesterol down quite low with medication, but if you're not moving, if you're rather sedentary and your nutrition's quite poor, your blood pressure's high, you smoke, you drink, etc., I would argue it doesn't really matter what I get your LDL, your bad cholesterol down to. You're still at increased risk. Okay, that's really, really important. And that's more difficult because the other things aren't controlled with medication. All right, so modifiable: blood pressure, smoking, nutrition, weight, cholesterol. Diabetes is another one: alcohol and exercise, diabetes or insulin resistance. And in that regard, I mean type 1 and type 2 diabetes, because type 1 and type 2 diabetes both increase your risk of cardiovascular disease. Okay, so today we're going to concentrate on smoking and alcohol. We're going to tackle smoking first. Now, most people, if not everybody, gets the link between smoking and lung cancer. okay, because that came to the fore many, many years ago. It was probably one of the earliest epidemiological studies that showed there was a, you know, a causation or a link between something that we did and ill health. So it causes 70% of lung cancer. It also increases lots of other cancers, though. There's hardly an organ in the body that smoking doesn't affect. Mouth, throat, which are quite obvious because obviously that's where you're ingesting or inhaling. But it also causes bowel cancer, bladder cancer, kidney, liver, stomach, pancreatic cancer. All right, so it's high up there in causation in terms of cancers. It also causes lung disease. Most of you will have heard of COPD, or chronic obstructive pulmonary disease. And if you have know somebody that smoked for a long time, they may suffer from this. And that's not very pleasant the further along you get with the disease, and many people end up having to be in long-term oxygen. Okay, so we know that increases the risk of cancer. We know that it results in lung disease. But what we possibly don't appreciate as much is the link between smoking and cardiovascular disease. All right, there's a clear link between smoking and an increased risk of atherosclerosis. And atherosclerosis is just the technical term for the buildup of fatty plaques. So the fatty plaques are called atheroma, and the disease process is atherosclerosis. And that's essentially what happens when the fatty plaques clog up your arteries. Now, if you've got a problem in your heart, your coronary arteries in your heart, that will result in a heart attack. If it's in your head, it will result in a stroke. And if it's in your legs, it will result in peripheral vascular disease. And that's all comes under the term cardiovascular disease. It affects lots of different areas in your body, and that is increased by smoking. Okay. So what does smoke do? Several different things. There are chemicals in cigarettes that are thought to make the arterial wall more sticky. Okay. Which results in increased fatty and atherosclerotic plaque formation. We also know that LDL, which is the bad cholesterol, so if you can remember, we break cholesterol down into HDL, which is deemed the good cholesterol, and LDL, the bad cholesterol. And in terms of bad cholesterol, I mean when there's a high amount of LDL in your blood, that's this stuff that can lay down and result in fatty plaques and therefore blockages leading to heart attacks, etc. Now, that LDL, it's a very complicated process, but making it very simple, is taken up by cells in your blood called macrophages to form foam cells. Now, the macrophages take up the LDL more readily if it's oxidized. And if you smoke, your LDL is more readily oxidized. Okay, so essentially, all you have to remember is if you smoke, your LDL in your blood becomes oxidized. It's more readily taken up by macrophages. The macrophages then stick to the inside of the arterial wall, and you get fatty plaques. So the process is just accelerated. Now, if anybody's got any problems with their legs and they've got intermittent claudication, and by that I mean they've got problems with their calf muscles when they go out and walk, their calf muscles get sore, and they've been referred to a vascular surgeon. The vascular surgeons are very, very keen for people not to smoke, probably more than the cardiologists and the stroke doctors, because the link between smoking and peripheral vascular disease is really strong. So if you get diagnosed with peripheral vascular disease, you've got problems with your legs, smoking is a no-no. I would also suggest if you have any heart surgery, have a stent put in, or you get a coronary artery bypass graft, smoking is a no-no because you will clog up the arteries quickly again. All right. So, but that's essentially the link between smoking and heart disease. It just accelerates the process of laying down fatty plaques in your arteries. Okay. Any questions about that? No, all good. Right. Okay, so other effects of smoking, it increases the risk of blood clots, it increases your heart rate, and it also increases your blood pressure. And blood pressure is very tightly linked, as we've previously discussed, to having a stroke. Okay, so those are 2 or 3 other things that smoking does. In terms of what's in a cigarette, there are lots of different things in cigarettes. Excuse me, I'll just let Babs in. Lots of different things in cigarettes. First of all, there's carbon monoxide, which you'll probably all be aware of. That's a poisonous gas. And how it affects you is the fact that carbon monoxide decreases your oxygen binding capacity of your red blood cells. So your red blood cells pumped through your blood from your heart to your lungs. Those red blood cells pick up oxygen in your lungs. That oxygen binds to the red blood cell. The red blood cells wheat around the body and release the oxygen into all your organs, like your muscles, etc., which need oxygen to function. When you smoke, some of that oxygen will be displaced by carbon dioxide. So smoking, therefore, decreases your capacity to carry oxygen around to the rest of your body. And that's why your heart has to work harder. All right. The carbon monoxide is also a poisonous gas and will damage your lungs. The tar in cigarettes also increases ischemic heart disease. Okay. And then also nicotine. Right. So nicotine is the villain, probably more than the other things, because it's the thing that makes smoking addictive. And they obviously knew this many, many years ago, although it took many, many years to prove, I think, but this is what makes it addictive. As well as making it addictive, which makes you go back again and again, nicotine increases your heart rate and blood pressure. And again, as previously mentioned, increase in blood pressure increases your risk of stroke and cardiovascular disease. Of note, nicotine is also in e-cigarettes. All right. I always get asked about e-cigarettes at this stage. As far as I'm concerned, vaping should only ever be used to get you from cigarettes to vaping to stop smoking. I actually had a patient several months ago last year who was in her 50s who'd taken up vaping and had never smoked, which blew me away. The fact that young children or children are now vaping is horrendous. It's like reinventing history. And the people who've designed these things that have flavors in them, like banana or cherry bakewell or whatever, should be drawn and quartered, as far as I'm concerned. I think that's absolutely horrendous. That's just my personal opinion. Okay, I just think, you know, we established, you know, many years ago, smoking was a thing to do. It was a social thing to do. We then discovered its link with lots of different problems, whether it be lung cancer or heart disease. Vapes were originally designed, I think, by a young person in Japan whose father had died of lung cancer, and they wanted to design something that would, you know, get people to stop smoking. And that's what they should be used for, but they should not be used as something that you start instead of smoking. They've got nicotine in them, which makes them addictive. You also will be ingesting particulate matter into your lungs. And I wouldn't like to ingest anything into my lungs apart from fresh air. We probably ingest enough particles in our lungs just being in a city, I would suggest, that, you know, probably isn't great for us already, but we do not need to ingest. So that's my take on e-cigarettes, okay, or vaping. It's a step down process. It is not to be started as a social thing. Okay, so that brings me on to stopping smoking. When you stop, your heart rate and blood pressure will normalize after about 20 minutes. Your taste and smell will be different in 2 to 3 days. Breathing and exercise will be better after a few months. Not laughing at them for around, but the expression in your face around flavored. Yeah, okay. Yeah, my face usually tells 1,000 words. I'm one of those people who, if I don't say anything, you'll know what I'm thinking just by the expression on my face. I'm also a really no on the smoking, and we'll come back to this. I'm going to show you a little graph in a minute as well. And the risk of your heart attack is half that of a smoker when you've given up smoking for a year. Okay, so it's really the benefits are huge. Other benefits: better breath. It affects your collagen. You can often tell smokers. I'll be able to tell a smoker when they come into clinic. Smokers often look older than they are in their years, because your skin ages quickly if you're a smoker, or more quickly. Increased energy, decrease in headaches, and a better immune system. Okay. Yeah, and again, smokers, having worked in acute medicine, usually obviously struggle more with infections because their lung capacity isn't as good, etc., etc. It's never too late to stop. Okay, if you quit by the age of 30, you can increase your life expectancy by 10 years. At 60, you can still increase your life expectancy by 3 years. Okay, that's quite a lot. So I'm not going to show you a little graph. Now, this was a graph that I have always remembered. It was one of the professors when I was a junior doctor showed this to me. And I often draw this for patients. Okay, so if you give me a wee nod, if you can see that. Okay, it's very simple. Art is not my thing. All right. So basically here on the y-axis, I've got IHD, which is ischemic heart disease. So that's the rate of ischemic heart disease. And then along the bottom is just your age, 0 to 80 years. Okay, this curve just shows the natural progression. So as you get older, you're more likely, your rate of ischemic heart disease goes up. Okay, you're more likely to have a heart attack at the age of 80 than you are at 10 or 20 years of age. If you're overweight and got an elevated body mass index, that's essentially what you do to your cardiovascular risk or your risk of ischemic heart disease. Look what happens if you smoke. So indeed, in my clinics, I am more trying to get people, I would like to get people to stop smoking even before we tackle body mass index. Okay, because that's how important it is in terms of ischemic heart disease. It's hugely, hugely important. Okay, really, really important. Smoking is not good. Okay, any questions regarding any of that?
Yeah, I've got one.
Okay, Margaret.
The smoking, was that smoking on its own, or was that with the other factors as well? So, you know,
What the graph have just
showed us.
the graph have just shown. No, that will have just been taken into account. They'll have allowed for they'll have adjusted for all the other things.
Right.
So yes, if you're asking if you're overweight and you smoke, is it a double whammy? I would suggest yes, but no, they'll have allowed for that. And it's just a general. I mean, I've just literally drawn that, and it was a rough graph that, you know, as I said, one of my professors drew for me when I was a junior doctor for the very first time in the lipid clinic, and it was just showing that, you know, naturally, if you don't smoke, you're not overweight. That's your natural progression for heart disease. If you've got an elevated body mass index, you've got an increased risk, and then smoking increases that further. That's the kind of simple take-home message for that.
Yeah.
And yeah, it's a roughly drawn graph. Okay. Wait a minute, I should be looking at my. Can I see my?
Is it a similar kind of thing with secondhand smoke as well? Or
Secondhand smoke, actually, I read recently. I'm doing a course in lifestyle medicine at the moment, and it's not that I didn't really think of secondhand smoking. I didn't consider that as serious, but no, secondhand smoking is, and especially for children, I think there's quite a strong link between secondhand smoking, not heart disease per se in children, but more like asthma and things like that. No, and the other thing where you can get secondhand smoking, which I hadn't thought of, even if you don't smoke in front of somebody, as in real time, the chemicals that stick to furniture and stuff hang around for ages, apparently. And you can still be inhaling some of those. I wasn't aware of that at all. And I find that really interesting. So yeah, there should be no smoking indoors at all, I would suggest. You know, even if younger people or somebody else isn't there. It's funny though, secondhand smoking is one of those things. Now, if I walk through, it doesn't happen very often, but the odd time outside a restaurant or a pub or something, somebody might be smoking and you'll walk through it. Well, I hardly ever smell cigarette smoke anymore, but when you do, it's really quite poignant, isn't it? It's quite funny. So no, the no smoking inside is a huge thing. Which is really, really good. But no, there's a link between secondhand smoking. It won't be as severe as the smoker, but no, there can be health consequences of secondhand smoking. It's funny, my husband tells me, because he's in his mid-50s and his father smoked and used to smoke in the car, I think, when my husband was a kid. But that was, 60, 70, yeah, 50 odd years ago, I guess, but this dad had been smoking since he was about 14.
I was just going to say, my stepbrother, he died of lung cancer. He never ever smoked a cigarette, but his wife smoked like a trooper.
Right.
And yeah. There's someone else. I think it's my my nephew's wife. Her father just died of lung cancer. He never smoked, and yet it was his wife who smoked. So yeah, I think there's a lot to be said for secondhand smoke.
Yeah, there will be. Now, I've said at the beginning, it's about 70% of lung cancers are caused by smoking. So that means about a third of lung cancers, about 30% aren't. You know, and people, we know people get cancers for all sorts of different reasons. We also know, I mean, smoking is one of those things. Somebody can smoke for 10 years and get lung cancer, and somebody can smoke for 50 years and never. Well, my father-in-law, he's passed away now, but he passed away in his 80s and smoked for, I think he was a farmer. He smoked when he was in his early teens. Funny, gave up smoking. I was quite terrified. I was a very junior doctor when I met my husband, and I remember I was away I was in a hospital, staying there for 5 weeks, I think, or staying there Monday to Friday. And I remember my husband at the time was my boyfriend, and he phoned and he said, "Oh, my father's just given up smoking literally overnight." And I remember thinking, oh, because that happens. It's a thing that people who smoke often give up smoking, and then about 2 or 3 months later, they get diagnosed with lung cancer or something. However, he had fallen and cracked a rib, I think, and it was just too sore. So he decided, and he literally given up overnight. It was quite impressive after 50, 60 years of smoking. But he didn't get diagnosed with lung cancer. So again, yeah, he passed away in his 80s and he didn't have lung cancer, and he'd smoked for years. So it's one of those things. But yes, I would imagine there's likely a link between, you know, if there's a family member who smokes a lot and you've been exposed to that, that will increase your risk. It most definitely will, which is tough. Okay, so smoking cessation. These are the kind of tips I've got off the NHS website. So I'm just going to run through some of these. And it's a wee bit, I guess it's a wee bit like weight management. Okay, it's like wanting to give up anything. Think positive. Okay, you may have tried umpteen times before, but do not let this put you off. Okay, make a plan so you can set a date. Consider your diet. Apparently, meat makes cigarettes more satisfying, but fruit and veg doesn't, funnily enough. So there you go. You can hit your nutrition goals at the same time. Drinks affect, you know, you'll often see people who smoke with tea or, well, coffee, and alcohol kind of goes more with cigarettes, whereas water and juice doesn't. So again, if you switch to water, your cigarette may not be the same. Identify when you crave a cigarette. So again, it's all behavioral, isn't it? It's a wee bit like comfort eating, etc., etc. So the craving can last for 5 minutes. So you have to make a list of things that you can do, or 5-minute strategies that help you not use the cigarette. So if you're out, for example, get up and dance. Get support. You're 4 times more likely to succeed giving up if you get help. You can either do this with family or friends. And I often find patients, I'll often ask in clinic, does your partner smoke? Because I think if you're trying to give up smoking and your partner smokes, it must be nearly impossible. It must be really, really difficult. And again, that's a bit like when you start TSD and you're following your recipe plan and trying to change what you eat. If the people in your household are not supporting you, that's going to be a lot more difficult, isn't it? You really need to get everybody on board. Get moving, stretching, or 5 minutes of yoga or 5 minutes of walking, again, just to get over that urge. Keeping your hands and mouth busy. So e-cigarettes, yes, I would use those to get from smoking to e-cigarettes to off smoking, but not in their own right. Nicotine replacement therapy is very useful, and it does increase your chance of quitting. So I often chat to patients about quitting smoking, and you should, through your GP, be able to find out what kind of things you can be helped with. So nicotine replacement can be tablets, patches, lozenges, gum, and nasal spray, and they can all work really, really well if you have a plan. And I guess my advice would be, if I wanted to give up smoking, or somebody wanted to give up smoking, I suggest you go and speak to your GP and see what's available in the community. You may not have to see your GP for this. There may be anti-smoking or stop smoking programs in your community, etc., etc. And then make a list of reasons to quit. Lots of people quit sometimes because they've sat and worked out how much it costs them smoking per week, and then multiply that up and find out what it costs them per year. Okay. And the other thing is non-smoking friends. That will help, I would suggest, because again, if you're smoking with your friends, it's very difficult. And Jacqueline's just said about you agree my adult kids smoked, use vapes to get off cigarettes, but now they're addicted to them. They affect my asthma if they vape around me. Yeah, vaping's really difficult, but I guess use the same strategies to try and get off vaping by using nicotine replacement therapy, because again, unfortunately, well, there's nicotine in vapes for a reason. Okay, but it is very, very difficult. Okay, so that's us. I've pretty much covered smoking. Any questions about smoking or anything? Anybody get any other thoughts? No, all good. Right, excellent. Okay, so we're going to move on to alcohol. And alcohol, all about the units. Okay, so can anybody tell me what the UK government's recommended intake of alcohol is per week?
Is it 14 units for a woman and 21 for a man?
That's what it used to be. It's now 14 units for everybody.
Ah, right.
That changed. When did that change? It wasn't that long ago. It was within the last year or two. So yeah, it's 14 units for everybody. So that changed recently. The other caveats are not all at once. So you can't have your 14 units, or you shouldn't, should I say, have your 14 units on a Friday night. And definitely alcohol-free days. Okay, so
Don't they say if you have more than 3 units in one session, they class that as a binge drinker?
Yes, yeah. So not all at once, and alcohol-free days. Now, I think alcohol has changed recently. I listened to a really interesting podcast last year, and it was about a guy he wasn't an alcoholic. He would maybe say he was a habitual drinker from the fact he maybe had alcohol most days, but maybe 1 drink, 2 drinks, maybe a couple more at the weekend. And he decided to stop drinking. And he just reflected on how, I think he did the whole, dry January and then increased it to 2 months and then 3 months, and the difference he felt in himself and how he's transformed in the last few years of not drinking. But also, one of the big things about drinking is the social aspect. But one of the things that has really changed in the last couple of years is the non-alcoholic beverages that are now available. If you go into any of the supermarkets, there used to be a couple of these. There's now basically, the end of, I was in one of them the other week and looking at a couple of things, and there can be 2 or 3 shelves loaded with non-alcoholic drinks. And that's really good from a social point of view, and we're going to come back to that. But first of all, I just want to discuss what a unit is. So we've said UK government has suggested 14 units per week for males or females, not all at the same time, and alcohol-free days. And as Margaret has said, more than 3 units is seen as binge drinking. Now, what is a unit? A unit is 8 grams per 10 mils of pure alcohol, and it's essentially the amount, on average, a person can process in 1 hour. And you'll often hear people chatting about that. I had a drink, but it was 3 or 4 hours ago, so I should have cleared that alcohol. I do not chat to my patients about 8 grams per 10 mils of pure alcohol. Okay, I would say that was fairly senseless. So what is a unit? Half a pint of normal strength beer, so that's about 3.6%. The other thing is, when we all started to chat about alcohol, and when alcohol was first, in terms of driving and how many units, there are lots of different strengths of alcohol now. You can get, stronger wines and stronger beers, and it's quite a spread, whereas previously there wasn't such an array, but there's quite a lot. So half a pint of normal strength beer being deemed to be 3.6%. A single shot, 25 mils of a spirit, which is 40%. And then a small glass of wine, which is 1.5 units. Okay, now a small glass of wine is 125 mils. Some places you go out, you can get a small glass for 125 mils, but most glasses just come as 250 now. Now, 250 mils of wine is 1/3 of a bottle. You only get 3 glasses in a bottle if you're drinking 250 ml glasses. And that would be a 250 ml glass of wine would be 3 units. And that it also depends on how strong the wine is. So that's units. which are very important. And I also, when I'm in clinic, I'm always asking about what people drink. Some people are very honest and literally tell you exactly how much they're drinking. Some people, not that I'm saying they're not honest, but they probably don't realize exactly how much they're drinking. One of the things I often ask is, how many bottles of wine would you buy a week when you're doing your weekly shop? And that usually highlights that, oh yeah, I would buy 3 or 4 bottles and they would have been used at the end of the week. I usually kind of guesstimate about 8 units, 8 to 12 units for a bottle of wine, okay, depending on the wine. The other thing about alcohol are the calories, and if being in TSD, I'm sure you'll all be very aware of this. So let's go back to carbohydrate and fat. How many kilocalories are in a gram of carbohydrate and protein? 4. Yes, excellent, 4. So there are 4 kilocalories per gram of carbohydrate and protein, and there are 9 kilocalories per gram of fat. Hence why you will be, your nutrition in terms of TSD will have less fat in it, because you don't get as much bang for your buck. Okay, unlikely to make you feel full. Alcohol sits in the middle. It's 7 kilocalories per gram of alcohol. So you are actually, if you have quite a hefty alcohol intake during the week, you've actually got quite a hefty calorie intake. And often, many of my patients, I see lots of patients with dyslipidemia. So these people will have high triglycerides, be overweight, fatty liver. And when we chat about alcohol, if they do nothing else but just reduce their alcohol intake, they often lose weight because of the calorie burden from the alcohol. And that does 2 things. 1, it helps their liver, and 2, it decreases their alcohol. So that often fixes their triglycerides, their high triglycerides. Which brings me on to, what can alcohol do to the body? Ooh, lots of things. Right, so heart disease. What can alcohol do to the body? Alcohol can give you a fatty liver. It's not a non-alcoholic fatty liver, but it gives you a fatty liver. And it's the same process of a non-alcoholic fatty liver. You get a fatty liver to begin with, which moves on to fibrosis and then inflammation and then cirrhosis. Cirrhosis increases your risk of liver cancer. Alcohol increases your risk of heart disease. It increases your levels of triglycerides because it's affecting your liver metabolism, and also can affect your total cholesterol because of your liver metabolism. It increases bowel cancer, breast cancer. It's directly linked to pancreatitis. So a habitual drinker, or someone who's drunk most days for many years, can have a problem with their pancreatitis. And this can lead to diabetes, because, and it's not type 1 diabetes per se, it's sometimes they call it type 3C or whatever diabetes. I just call it diabetes secondary to pancreatic insufficiency, probably is the best way to look at it. But you can chronically damage your pancreatitis. The biggest effect I see in clinic in terms of cardiovascular disease and risk and pancreatitis is the elevated triglycerides. So just to recap on that again, so your triglycerides are another fat in your blood, primarily used for energy. So that's how we store fat. Triglycerides are made up of glycerol and fatty acids, but that's how we store fat. It's also how we store refined carbohydrate. If we've replenished our glucose stores in our muscle and our liver, the excess glucose will then be converted to triglycerides. And triglycerides are very useful when we need energy, but the excess are stored either under the skin, subcutaneously, around your organs, visceral. So if we have an excess of refined carbohydrate or fat in the diet, we'll get a fatty liver. Now, normally your triglycerides, as part of your lipid profile, fasting should be less than 2.3 millimoles per litre. But we've people can get the triglycerides up to high as 50, 60, 70 millimoles per litre. And that's often got to do with being 3 things: overweight, truncal weight around your abdomen, around your liver, diabetes or insulin resistance, and alcohol. When your triglycerides are above 10 millimoles per litre, you do have an increased risk of pancreatitis, and that's pretty awful. You can end up in high dependency or intensive care with pancreatitis. Your pancreas is a small organ, part of your digestive system, and it produces enzymes to break down food, and it also produces hormones such as insulin and glucagon, which control your glucose levels in your body. Okay. And a cause of pancreatitis can be chronic use of alcohol over many years. Okay. Little caveat about type 1 diabetics and alcohol. This can result in hypoglycemia, low glucose levels, and all type 1s should be educated regarding that. It can be very dangerous, especially if you've been out for an evening, you drink quite a bit of alcohol, and then you go to bed. Your liver may not be able to deal with your glucose the same way someone who doesn't have type 1 diabetes. And you often either have to reduce the insulin you take if you're drinking, or indeed take additional carbohydrate to ensure you don't become hypoglycemic overnight when you're sleeping. Okay, so alcohol, it's a calorie burden. It affects lots of organs in the body. Again, habitual or long-term drinking of alcohol can result in what we call cardiomyopathy, which is a big floppy heart, which can lead to all sorts of problems and can be irreversible. So again, that's another problem with alcohol and your heart. Okay, so again, everything in moderation, but one of the things I think is very useful at the moment in terms of calories and also alcohol affecting your body would be non-alcoholic drinks. Okay, because one of the big things in terms of people's overall well-being is social interaction. And where can we do that? One of the best places to do that is in a pub. But the problem with going to a pub is people drink. So if we increase the use of non-alcoholic drinks, you can still go out, meet your friends, meet family, socialize, and get that social aspect. It's very important in terms of your overall health and well-being, but you're not necessarily consuming the alcohol. Which brings me on to TSD and top 10 tips or top tips for what we can do in terms of reducing alcohol when we're in company. Because again, there's a lot of peer pressure. It's funny, I was reading an article this week. If I turned around tomorrow in front of a crowd of my friends and said, right, guys, I'm going to give up smoking, nobody would probably bat an eyelid. A couple of people would probably say, yeah, no, that's a, good idea, whatever, etc., etc. That might be quite tough, but we're here to help you, or whatever. If I turned around in front of all my friends and said, right, guys, never drinking again, what do you think the difference would be? Unfortunately, in society, it wouldn't meet the same.
Probably shock horror.
Yeah, it would. Yeah, and even really good friends would just be kind of like, and to be honest with you, I have in the last 12 or 18 months, basically because I never drank a lot of alcohol. When I started TSD, I drank even less because of the calories. And now when I do, I could literally have a glass of Prosecco at a birthday party or a glass of wine. And not unless I have drunk a lot of water or been very careful, I will have a headache the next day. And it's one glass. So I am very much veer towards non-alcoholic drinks now, non-alcoholic gin, and non-alcoholic wine, etc., etc. And nobody said anything to me yet, but you just get that impression when I'm out, am I not going to be the same fun person?
It's interesting because I gave up alcohol, well, when I had my gallbladder out, just to give my liver a chance to recover, and never really went back to it. But when I joined a book club, they all kind of thought, oh, alcohol goes with the book club, da da da. And it's not that I don't drink at all, I just very rarely drink. And it took them probably 3 years to stop offering me a drink when we would get together. So.
Yeah, and I think the non-alcoholic drinks, if I didn't like the taste of them, I wouldn't. The non-alcoholic gins, you literally could not even blindfold me, just put two of them down and I would be none the wiser as to which one's which. And that's all got to do, I've got a friend who works in the drinks industry, and that's all got to do with the botanicals, apparently. Some of the wines you could probably tell, I think, but definitely not the gin. So when I started TSD, which was over 4 years ago now, January 21, there was part of the app that we listened to, or there was a session, I think it was either a list given out to us or a session that Alex had recorded himself. How can we alter drinking behavior in company? So I thought we'd just do a revision of this. before we finish this morning, if that's okay. So either from what you've been doing since you started TSD, or if you can remember going over this, what are kind of TSD's top tips for altering your drinking behaviour in company, if you want to do so?
Drink water in between drinks, rounds.
Yeah, so alternate drinks, make sure you have a big glass of water in between, which is good. Yep. And along with that, drinking water in between is also drink water first. So Alex often suggests if you're going to drink alcohol that evening, not before you eat. Apparently alcohol can affect your appetite, can increase it.
Also, what you eat affects how you taste the alcohol. The alcohol affects what you eat, the taste of what you eat as well. So, you know, make sure you're not going to eat something that makes you want to drink more.
Drink. Yeah, and alcohol after the meal, again, just following on from that, you're fuller. So you won't have as much, you shouldn't theoretically have as much room.
Yeah.
Anything else?
Alex uses the thing of like, oh, I'm not drinking today. Kind of, there's a, you know, I'm getting up early, you know, to sort of postpone that thing of, you know, not that it's I don't drink, but it's a case of
not today. Yep. I'm busy tomorrow morning. I'm getting up at the scrape of dawn or whatever. Yep.
Yeah.
Yeah, no, that's good as well.
Make yourself the designated driver.
Yes, I do that all the time now. My husband's delighted.
Yeah, I do.
I'm happy enough to drive all the time, and that just gets round that, which is good. I don't mind driving. So put lime and sparkling mineral water in. Nobody has a clue. G&T all the way, but it's sparkling mineral water.
Yeah, I drink,
especially at the end of the evening.
I used to drink pints of soda water. And my tipple would be Archers and soda water. So people wouldn't know the difference.
Yeah.
And to be honest, I'd have about, you know, maybe one drink in the night, alcoholic drink, and the rest would be non-alcoholic. And, you know, if somebody was offering me one, it'd be like, oh, I've just had one, so I just need a soda water now.
Yeah, exactly.
And, you know,
so you're on your 5th soda water.
Yeah.
Which is good. Yeah, no, all good tips. Lots of ice is another one, and low cal mixer.
No.
So if you are going to drink, you can have lots of ice in it and a low cal mixer, so that kind of takes care of the calories a bit more. Other things they suggested is have a volume in mind. So again, a bit like you've said, Margaret, you've maybe decided to have one drink that evening. You'll have that at whatever time you choose, but out with that, you'll have your other soft drinks, yeah, or non-alcoholic.
If we have people around, I tend to pour the drinks, and sometimes I just have a Diet Coke rather than the vodka and Diet Coke because nobody knows what's in your glass. So choose to pour the drinks yourself.
Yes, that's a good one, especially if you're in someone else's, in your house, that's quite easy, but even in someone else's house, you know, one of my friends will say, Caroline, can I fill you up? And I'll say, oh, it's no worry, I'll get it. And off I toodle to the kitchen, and yeah, either don't put anything in or put a little, you know, it's a small measure if I don't really want to. Yeah, so drink water first before your meal, and then you're more full after the meal. Wine and sparkling water as well, and ice, that kind of dilutes the wine out as well, a spritzer. Alternate drinks, alternate your drinks with water, lime and sparkling water or soda water, etc. Nobody knows what you're up to. Prepare your own drinks. Have a volume in mind, know what you're going to drink that evening before you go out. It's a wee bit like I do this all the time now. It's one of the things I got from TSD, which I still continue to do. I look at menus all the time before I go out. There's nothing like turning up at a restaurant, being hungry and thinking, oh, I'm going to have something quite healthy. And then as soon as you see the menu, you're, oh no, I'm going to have X, Y, and Z. So always look. I was out on Sunday night for my son's birthday with my family over in Ireland, and I'd already sussed the menu. So knew what I was going to have before I got there. And that really, really helps me. It's really good in terms of food and what I'm going to eat. Right. Okay, so essentially, today we've discussed 2 of the modifiable risk factors for heart disease, smoking and alcohol. Smoking, it's really difficult. I've never smoked. but I know it's incredibly addictive. That's why the nicotine's there. There's the reason why that's been put in is to make sure people keep doing it. So it is difficult to give up, but you can give up, and especially if you try and get help. And again, any of that advice about giving up smoking's on the NHS website. You can follow that up yourselves. And then in terms of alcohol, a couple of issues. It's a calorie burden. It affects pretty much every organ in your body. And again, we've reviewed the kind of top tips for TSD so that we can be wily whilst we're out with friends drinking, etc., which is all good. Okay, right. So that's it for this morning. I hope you enjoyed that. And I will catch you next Wednesday. Anybody get any final questions or anything they want to ask?
I've just got one. It goes back to vaping. So you said that obviously the vapes have nicotine in and that, but there's vapes that are meant to be pure CBD oil.
Right, okay.
And somebody says that that's good for pain relief.
Well, presumably they can be used for pain relief. CBD oil. I'm not an expert in CBD oil by any stretch of the imagination. I don't have any, I don't prescribe it. I don't have any dealings with it. I know it has many uses though, and I know it can be used for people with seizures, etc., in different forms. My problem with that would still be you're still vaping particulate matter into your lungs. So even if they don't have nicotine in them, I would suggest you're probably still doing your lungs some damage.
Right.
So I don't know how else you would get CBD in though. But there's a trade-off, Margaret, okay? There's a trade-off with everything we do. I prescribe medications that will have side effects. And it's a balance act of,
I'll just carry on with the drops and things like that.
Yeah, I just think, yeah, I just think inhaling anything that's not fresh air is not going to do
not fresh in the city, really, are we? But
no, I know, I appreciate that, but it is what it is.
Yeah,
but yeah,
no, I know.
I'm not an advocate for inhaling stuff into your lungs. Slightly indifferent when it's inhalers and things like that are delivering medication. But and again, as I said, there's pros and cons and side effects that have to be weighed up with whatever. If you've got any medical condition and you've been advised to do so by a physician. Okay.
Excellent.
All right.
Thank you.
Okay, right. Have a great week, and I shall catch you all next Wednesday, hopefully. Okay.
Yeah. Okay. Thank you very much.
Have a good one. Take care.
Thank you.
You
Bye-bye.
too. Cheers. Bye.
Bye.
Bye.